Did you hear the one about the little old lady in Oregon which, by the way, has a government-run healthcare system, that state does, and, well, she got cancer. Well, she has some terrible disease, right? And the medication to keep her alive was $4,000 a month in the state of Oregon, and said, we just simply can't do that. And they said, we will, however, pay for you to die. And they did. And she's dead. She died. Some news channel went to interview some doctor that's in charge, one of the bigwigs in the Oregon state-run medical care system, and asked him, don't you think it's cruel that they would not pay for her to live, but they paid for her to die? He said something to the effect of, well, that's not what we're saying, but, well, if you want to interpret the letter of the law that way, that's not really what we're saying. No, it's not what you're saying. You're not saying anything. You're just doing it. Whoever thinks that's cruel, and whoever doesn't like it, and whoever wants to make a villain of the greedy big drug companies for, charging so much for this medicine, you can thank your socialist buddies in countries around the world, in Europe, like France and Germany and England, and north of the border here, Canada, and wherever else the countries just simply tell the drug companies, well, we're only going to give you X amount for this drug. We're buying the drug, but we don't want to pay what you want to charge us for it. Drug companies are like, well, man, we spent so many millions and millions of dollars researching this and this drug and testing and going through all the government tests that we all also had to pay for FDA, passing FDA inspection, the American bureaucracy that tests drugs for the government, the Food and Drug Administration. And, wow, why do they put food and drugs in the same administration? When they also have a USDA, U.S. Department of Agriculture, which that would be more like food, wouldn't it? Well, anyway, that's going off on another tangent. It's, overlapping bureaucracy, something that Barack Obama loves and wants to expand, by the way. But what I was saying was the drug companies, because the Europeans and the Canadians and other socialized healthcare system countries just tell the drug companies, well, we're not going to pay you that for it. Here, take this and give us the damn drugs. So the drug companies do. They have to turn a profit somewhere. They have to make it worth keeping their doors open and going to work every day, just like you do. Everybody needs to turn a profit somehow or other so that they can just continue going on in business and feed themselves. The drug companies, big pharma, ends up charging you, Mr. and Mrs. America, more for the pills because you have to make up the costs. Just like the whole medical care system in general in this country, you are paying for people who can't pay or don't want to pay. You with your insurance, your health insurance, they have to pay for all kinds of patients that you don't even know about, and those patients aren't paying. So that means that somebody, wherever the money's coming in, more money has to come in from that person. But no, you cannot say that people are not treated here. Everybody is treated. You walk in, man, with something wrong with you to any hospital you want, and they are going to treat you, unless maybe it's in Chicago where Michelle Obama used to work, and they'll shove you out the door and tell you to go down the street around the corner 17 blocks and then take exit 92A and drive for 15 miles and then get off the highway at Shit for Brains Boulevard, and it's number 9500A. And the name of it is Zach's General Hospital, Zach's Clinic for the homeless. I mean, when you get a big medical bill, as long as you send them like $1 or $2 a month, they can't bitch and complain about it. They'll get somebody else to pay for it, and then you're paying. You're kind of like, every one of us, because of the free healthcare system, we're kind of like these European countries. We can just tell them, yeah, I know the bill says $8,000, but I'll give you $1 a month for the next 8,000 months. How's that? And that's all people do, man. As long as you pay it and you put a dent in it, you keep on paying. They're getting money. They're not gonna. They might hassle you on the phone, which I've never heard of. If you're paying them anything at all, they leave you alone. And as far as I know, from my own personal experience, which I'd rather not get into, which is the reason I'm staying out of a hospital in general. But yeah, that's all I had to say.